On top of Fall Prevention Awareness Day coming up, September is also AFib Awareness Month. Dr. Deo is about to explain what AFib is and why it's so important to be educated.
Atrial fibrillation is the most common abnormal heart rhythm that we see as cardiologists and electrophysiologists. The heart is comprised of 4 chambers. There are the 2 upper chambers, which are the atria, and the 2 lower chambers, which are the ventricles. Atrial fibrillation arises from the upper chambers, the atria, spreads throughout the rest of the heart, and is manifested by an irregular heartbeat or irregular heart rhythm. Patients may be asymptomatic, or patients may have significant symptoms such as palpitations or the sensation of feeling abnormal, skipped, racing heartbeats. Patients may also experience shortness of breath, chest pain, lightheadedness. As physicians, the most important component of the management algorithm involves our assessment of a patient's potential risk of stroke or other embolic event. Atrial fibrillation, as well as a series of other risk factors when present, can increase the risk of stroke or a thrombotic or a clotting event. In order to safeguard from that risk of stroke or other embolic event, our recommendations for management are the initiation and maintenance of an anticoagulant or blood thinner. There are a series of different anticoagulants available. Warfarin or Coumadin is a medication that has been used for the last several decades, but more recently we have novel oral anticoagulants as well. One of these medications should be chosen to prevent the risk from future stroke or embolic event in individuals with atrial fibrillation and other risk factors. We know from multiple studies that have consistently demonstrated that the risk of having a thrombotic event or a stroke is significantly decreased when an individual takes and stays on an anticoagulant medication. Of course, these anticoagulants can also increase the potential for bleeding. However, again, it's important to note that the clinical benefit significantly outweighs the potential harm for bleeding. In select individuals who have a traumatic event while they're taking a blood thinner, such as an anticoagulant, there may be more bleeding and there could be other bleeding complications. Those individuals should certainly present to the emergency room and see their physician, where in some cases a reversal agent can be administered. Some of the blood thinners that are currently available, or some of the anticoagulants currently available, including dabigatran or Pradaxa, have a reversal agent available that acts immediately and completely to reverse the anticoagulant effect.